Health systems generally aim to improve population health, provide equitable access to healthcare, ensure quality of services and products, and provide value for money. That is, they aim to provide services efficiently. In health policy, we therefore look at the role of competition through the wider lens of these objectives. So competition in health systems, or more narrowly in healthcare, is a means to an end. It's an instrument for organizing decisions about the use of resources that can help attain broader goals. We might generally expect competition to strengthen patient choice, to stimulate innovation, to improve the quality of services, and to control their costs, and ultimately to enhance efficiency. But it is also widely recognized that competition may be less desirable in domains where it is difficult for people to make informed choices or when the costs of a bad choice are substantial. Healthcare is often quite far from the ideal model of a perfectly competitive market. Among other market imperfections, key problems in healthcare are informational asymmetries between patients, healthcare providers, and healthcare payers. This means that unconstrained competition does not always achieve desired policy goals. To varying extents, countries therefore regulate competition in healthcare. Regulation includes mechanisms such as professional licensing, product quality standards, price regulation, or yardstick competition in paying providers. But such regulation can also slow down the adoption of new ways of delivering healthcare. For example, telemedicine, which refers to the delivery of healthcare services across a geographical distance using communications technology, is seen by many as a powerful tool. It is expected to increase access to services in remote and underserved areas, to increase patient convenience, or to reduce service costs. However, medical licensing, the regulation of the exchange of electronic patient data between healthcare providers, or the absence of insurance coverage of services have been major barriers to the adoption of telemedicine services. The distribution of medicines is another example where regulation constrains the adoption of new services and impedes greater competition between pharmacies. Regulation aims to ensure the quality of products and patient safety, as well as a sustainable distribution network of community pharmacies. In some OECD countries, medicines are now available through the internet, while other countries continue to restrict online sale. France, for example, has taken a restrictive approach and prohibits the online sale of prescription drugs. Only non-prescription or so-called over-the-counter drugs can be sold online, and only pharmacies that are licensed in France may sell them. Germany, on the other hand, has taken a less restrictive approach. Since 2004, all pharmacies in countries of the European Economic Area with comparable standards for online sale can sell prescription drugs to German patients. This has caused debates about the effect of such competition on local community pharmacies and about applicability of price regulations. Countries need to find a balance between using regulation to protect patients and achieve health system goals, while avoiding the creation of regulatory regimes that are too rigid and overprotect healthcare providers from competition or impede the adoption of new services. This is not an easy task.